I'd like to start off by saying that although I think we've been listening to the debate and talk on healthcare for, it seems like, forever now, the issue of students and their relationship to this whole healthcare discussion has kind of been left out. So I was hoping that we could start to change that today.
Wonderful to get a chance to join you, and I'm so glad to see so many here. Thank you to WISPIRG for organizing this, because I think healthcare reform is of great significance to young people and college students in particular. I hope that at the end of the day, and this is a controversial matter, but I hope at the end of the day that one of the many choices in the insurance exchange will be a strong, publicly sponsored health insurance option. Because I believe that that's going to rein in costs, bring competition from an entity that isn't driven by profit motive, competing side by side and on a level playing field with the private for-profit and private not-for-profit health insurance. I'm a Madison native. I was born and raised here, and raised by my maternal grandparents. My grandfather was a professor here at the University of Wisconsin. For my first 6 years of life, my grandmother was academic staff on this campus and actually worked in this building. When I was 9 years old, when I was in 4th grade, I became very ill with a childhood illness that left me in the hospital for 3 months. My grandfather, who was a university employee and had university health coverage, found out that it didn't cover me because under their technical rules, I wasn't considered a family member. I wasn't a dependent because I was their granddaughter, not their daughter. And it ended up, and of course medical expenses weren't as high back then as they are today, but my grandparents had to pay for a 3-month hospitalization out of their own pocket. And if that weren't enough, I was basically ineligible to be covered by insurance from that point forward because I looked like a high-risk kid. Even though I had something, I recovered from it, there was no likelihood it would ever come back again, but on paper, when the actuaries get to it, I looked like somebody who wasn't a particularly good bargain in terms of covering for health. And according to family folklore, because I was awfully young at the time, that I had no insurance until I finally got some coverage while a college student and later a law student. And after that, I've been lucky enough to have insurance provided through my employer. I first ran for office motivated by the injustices that I heard about all the time. It's the most frequent issue that people write to me about. In the last attempt, no bill got out of any committees even in either house of Congress. So right now we are at the stage where significant health reform, not perfect health reform, but significant health reform has advanced out of the 3 relevant committees in the House of Representatives to the House floor and now out of the House. It's come further than it's ever come before, which gives me great hope that this time we can get the job done. And it won't be finishing the job, but it will be an important stop. Let me talk quickly about the 3 major elements of the health care reform bill that came out of the House. There are basically 3 parts to it. The first part sets up what's called an insurance exchange. And that exchange is intended to be like a shopping mart, a supermarket of health insurance plans for those who currently have no health insurance at all. They don't have that option of securing health insurance through their employer or through their university or wherever they happen to be at that point in time. And because it will be a sort of marketplace, there's going to be competition. And what we're hoping is that there will be great transparency so you really can comparison shop and compare this plan to that plan to the other plan, see what they offer, see how much they charge, compare it with your medical needs as well as your fiscal budgetary needs, and be able to select something that works. There's going to be help for people who are lower income or even moderate or middle income to be able to pay their premiums. And in addition to that, there is going to be a ceiling placed, a cap, on how much out-of-pocket expenses are associated with the plan that you select in the exchange. So you have your premiums, but you know the other way of getting at you is deductibles and co-pays, etc. And so those will be strictly limited by income, so that low-income people have a lower annual income limit than people with more resources to expend on their health care needs. The second part of the bill forms in the Medicare and Medicaid system. Now, most people in the age group here in this room may not be exposed to either of those programs. Medicare is predominantly for senior citizens, 65 and older, and some people with disabilities. And Medicaid is for people who are very low income and certain people also with disabilities. But those are public programs that we think can drive some incredibly important reforms. Not insurance reforms, but reforms in the way that we pay for health care. Ways in which we can pay for higher quality care that's cost effective rather than just paying for every single test and procedure sort of separately. One of the things you hear often in this debate is the current way we pay for health care is we pay for quantity and not quality. And that's not the way we should move forward. If we're going to really rein in costs, we're going to have to make some strong and sincere reforms. And I'm not going to go into details now, but there are some very important reforms that are contained in that section of the bill that I think will inure to the benefit of all of us, even people who aren't participating in Medicare or Medicaid. We have too few practitioners in primary care health fields. Too few primary care doctors, too few primary care nurses, and other related health professionals. And we want to change that and create greater incentives for people to go into those fields of medicine that focus mostly on our wellness. Also, though, in that section of the bill are a number of programs that look at population health and community health. Ideas like, say, a community in an area wants to fight the obesity epidemic. So you can actually have programs that are being conducted in schools and community centers and senior centers as sort of lifelong programs in a community to fight obesity. We know that while those expenditures would go through, not through the medical system, we know that they're going to produce incredible savings for all of us in the medical system if we can prevent the onset of diabetes and other obesity-related illnesses. And so this is the section of the bill that really deals with wide population health measures. Now, I will tell you that I'm not completely satisfied with the version of the bill that came out of the House of Representatives, although I did vote for it at 11:15 p.m. Eastern Time Saturday night. I think that there are many improvements we can continue to make through this legislative process as it goes to the Senate, and ultimately the differences between the two bills are reconciled and it goes to the President. What I will tell you, and why I do strongly support this measure and urge you to do so also, is it addresses some of the most poignant and painful stories and issues that I hear from my constituents. I think about those who are turned away because they have some sort of pre-existing condition. As I described in my youth. People who have suffered a previous bout with cancer, but have now a clean bill of health, who are basically shut out of the private insurance, individual insurance market. I think of things like having mental health parity in this bill. I remember the letter that I got from a mother. It was so powerful. She said, 2 of my loved ones experienced life-threatening illnesses in the last year. I thought I might lose them both, and we're a family with full insurance coverage. Her husband had a heart condition, very serious heart condition. The insurance paid for 100% of his treatment and recuperation. Her daughter had anorexia, a very severe case of anorexia. Her insurance policy paid for minimal treatment, and they had to dip into their savings, second mortgage on the house, in order to make sure that she was recovered and reached full health again. And so these provisions are extremely important. Young Americans, young adults, are the highest, in terms of age demographic, experience the highest level of lack of insurance. And it's quite striking. 47%, nearly half, have gone without health insurance at one point or other in the last year, in the last calendar year. That's striking. Almost half have had a major gap in their insurance in the last year. One of the measures in the bill relates to being able to remain on parents' coverage for a lot longer period of time. Right now, from state to state, the regulations vary. But this bill will say in all states, a child after adulthood can remain on their parents' insurance up to their 27th birthday. That creates a much greater padding for going through probably undergraduate and sometimes graduate education, or in the case of somebody who's graduating from high school and going right into the job market, we know the chances of their getting a job with insurance offering right out of high school is oftentimes pretty minimal. So it buys them time to develop their career and perhaps be able to get into a job with employer-sponsored health insurance. But as you heard, while there was a great milestone achieved on Saturday night, there are impediments that stand in front. Among them, some amendments that have been attached to the bill that are unacceptable and need to be stripped before we review the bill for final passage. And the challenge that the Senate is not right now considering reforms that are as bold as those in the House. And we don't want to see this measure watered down any further. So I encourage you to keep on speaking out, to keep on organizing, to communicate to your school, your university colleagues that this is an issue that you have to keep on pressing on. And right now the action is in the Senate, so make sure Senator Feingold and Senator Cole know how interested you are in their progress and their strengthening of this bill. I know that they are working hard, and it only helps if they hear from all of you. So thanks for your interest in this issue. Thanks for being here today. I appreciate your involvement.
This reform can really make healthcare more affordable and more available to us, particularly once we do graduate. It's definitely going to help us a lot to be able to be on our parents' healthcare for up until we're 27, so that's really awesome. We're really excited about that. I think it's definitely something that needs to be, more awareness needs to be about it on campus, because it is something we all hear about it, we all talk about it, but this is kind of okay, let's do something about it now. We're students, we have so much power that we don't really realize, but with healthcare reform, it's something that is affecting all of us right now and when we graduate, so we do have a lot of power there.